Sir's talk is on ocular perfusion pressures in primary open angle glaucoma.
Good morning, I am Dr. Satyanarayana from Geta Ministry of Medical Sciences, Visakhapatnam. Today my talk is on ocular perfusion pressures in primary open angle glaucoma. So far we know intraocular pressure is the only reliable modifiable risk factor. So far recent studies shows in spite of having a good intraocular pressure control, still the glaucoma is progressing. So now we have to on a path where you have to search for the other risk factors, and here I would like to suggest that intraocular perfusion pressures are the other major risk factors. So I have no financial interest. So primary open glaucoma is a subset of glaucoma defined by open angle, raised or normal intraocular pressure, leads to the RNFL decay, optic nerve changes and visual field changes. So sufficient blood flow is mandatory for the normal optic nerve head functions as per Harris study. And major arteries that supplies to the eye are the ophthalmic artery and central retinal artery to maintain its normal function. So etiology glaucoma is uncertain still despite of many experimental researches, but hemodynamic alterations contributes to the glaucoma. So disturbance in autoregulation, unstable ocular blood flow leading to chronic ischemia of the optociliary bed and deep retinal veins and layers, and is a risk factor for the development and also the progression of the glaucoma. So low perfusion pressure is a definite risk factor, optic nerve head function, and low ocular perfusion is a potential risk factor for the development progression of the glaucoma as per all these 4 studies conducted. And the measurement, now we have to measure the ocular perfusion pressures, like these are the methods available to measure, to record all the ocular perfusion pressures, like ophthalmodynamometry, color Doppler imaging, laser Doppler velocity scanning, laser ophthalmoscopy, ICG, and transcranial Doppler ultrasound. So what are the major readings we have to look at? That is the peak systolic velocity pressure and diastolic velocity, resistive index, pulsatile index, and blood flow velocity. And among these two, we have focused on the peak systolic velocity and resistive index in our study. So resistive index, that is gives the resistance from the blood vessel, whereas the peak velocity is the volume that is given by the blood flow. So trabecular meshwork also responds to the circadian rhythms. So that's why the intraocular pressure is unstable. Unstable even for hour to hour, day to day, week to week, even for years. So this trabecular meshwork that responds to the circadian rhythm. So our aim is to record the ophthalmic artery and central retinal perfusion pressures. We have done this study from the Geta Ministry of Medical Sciences in collaboration with the Radio Diagnosis Department. We included 20 patients of open angle glaucoma, 20 of controls. So we excluded the criteria of the uveitis, ocular conditions, ocular trauma, post-operative eyes, and systemic conditions like hypertension, diabetes mellitus, cardiac cases, chronic autoimmune diseases, and COPD and steroid. So this is the machine we have used, that is GE Logic S8 with the probe of 9HZ, and we mainly concentrated on the peak systolic volume and resistive index. And this is the study we have done by recording this ophthalmic artery perfusion pressures. Sorry. And this is the ophthalmic artery perfusion pressure, and this is the central retinal artery perfusion pressures we have recorded. So this is the flow, these are the readings of the ophthalmic artery perfusion pressures, peak systolic velocity. And we found that peak systolic velocity in ophthalmic artery is reduced in glaucoma, whereas resistive index is increased both in ophthalmic artery as well as the central retinal artery. So these are the index of peak systolic volume, CRA, and the systolic velocity is reduced and the resistive index is increased. So we did the same study in one patient where the one eye is normal, other eye is glaucomatous with advanced stage, and also found that this peak systolic velocity is reduced when compared to the normal, and the resistance index is increased and compared to the other eye, normal eye. In conclusion, we state that the pre-systolic volume and resistance index are very important vascular parameters in the study of glaucoma, and peak systolic velocity is decreased whereas the resistive index is increased. And these can be included in the imaging diagnostic prognostic criteria for the open angle glaucoma. Thank you.
Yeah, thank you, Veera sir. So, ocular perfusion pressure, again, the more the technologies, more tests and investigations we have. I can only comment that the number of subjects which I noted, it was 20 in one of the studies, and then
It's a
I
small
think you
study.
did.
We have
Yeah.
initiated a small study.
Yeah, I think you did another study which you mentioned at the last, where you compared the same person, normal and high pressure.
High pressure, yeah.
So I think the number of subject in that was a little
We
more.
started doing this study.
You started doing the study, right? So that's a good study, of course. If we have all these technologies, then we can look into it.
Yeah,
but
wherever the
unfortunately,
facility of the radio imaging is available, we can refer these patients. For these studies are definitely worth taking, and we find that the positive results, which can be included in the diagnostic criteria, as well as the prognostic also.
right? So, yeah, prognosis also.
Right.
You're right about it.
Thank
So,
you.
any questions, Dr. Prerna and the house? Okay, I think everybody has gone to trade area or breakfast.